I was feeling some really bad chest pains. I had my cardiac arrest. From that point on, I was unconscious.
Gone, flatline. No pulse, no heartbeat, nothing.
For major emergencies, to the everyday healthcare needs of those who have no other option, the dedicated healthcare professionals at St. Joseph Hospital have always been there for our community. But with the enactment of the Affordable Care Act in January 2014, there will be an increased burden on emergency rooms all across the country.
The effect of the Affordable Care Act means that an additional 36 million patients will be thrust on the healthcare facilities of our country. In the emergency department, the brunt will be particularly severe. How will we deal with this great increase in patient numbers? We believe the time to act is now. The question then becomes, how do we treat more patients in the emergency department more quickly, yet maintain the outstanding quality of care that's associated with the name St. Joseph? As always, St. Joseph Hospital plans to be ahead of the curve by developing a totally new concept, which we call the Emergency Care Center.
St. Joseph Hospital's Emergency Care Center will use the latest technology and environmental design to improve patient throughput, staff and resource efficiency, and ultimately, patient satisfaction.
The key to all this is what we're calling rapid medical evaluation.
Rapid medical evaluation will help us cope with the expected increase in non-emergency cases by allowing us to identify, diagnose, and treat the most serious cases most quickly. Getting serious emergency cases into the system more quickly will allow more time for less urgent and non-emergency cases. We're exploring an internet reservation system that will allow patients with non-urgent needs to schedule an appointment. This will allow us to see these patients during non-peak hours, thus helping to move all patients through the system more efficiently.
The benefit is that patients will spend far less time waiting. The more rapidly we can move each patient through the system, the more patients we can see. It's just that simple.
Technology will play a pivotal role in improving department efficiency and responsiveness. Advanced systems, like teletracking, will be used to align department resources with patient demand.
With teletracking, we'll be able to monitor all the department operations real time. At any given moment, we'll be able to pinpoint the location of incoming patients, staff, consultants, and our physicians. We'll also be able to track room assignments, clinical workflow, recent admissions, patient discharges, and much more. Given this level of instantaneous information, we will be able to rapidly align the physician, imaging studies, medications, and even bed availability to closely match the needs of our patients.
Supporting teletracking will be an equally advanced health information technology that integrates data from various sources. It will provide real-time clinical data as well as administrative and financial information about patients in a single display.
Everything we need to know about a patient is right there, up to the minute, helping us to monitor patient flow and overall operations at the center. We're looking at a technology called telematics, which blends computers and wireless communication. It can allow our physicians in the emergency care center to evaluate patients while they're en route in the ambulance. We'll know what to expect and be prepared with the appropriate and necessary treatment.
The doctor came to me and said that they had called in the chaplain. So they were getting ready to call it, and one of the nurses said he knew that time was up and he wanted to give me my last second with my husband. He said, you know, you can tell him anything you want to tell him. I was going to tell him I loved him one more time, and then I was going to tell him goodbye. But then I thought, no, we fought for an hour, and I'm not going to give up. And I know how much his grandkids and his kids mean to him. So I kissed him on the head and I said, it's not your time. Your kids love you and you have to get whatever's left in you and fight. And after I kissed him, He had 3 beats on the monitor. He came through the next day, no neurological damage, no brain damage, nothing. And it was all because of the team down there that never gave up. And because of them, we have a life. Our grandkids know their grandfather. St. Joe's goes above and beyond, and they save lives. They truly save lives.
As we develop the new Emergency Care Center, we continue to explore new technologies and best practices that have the potential to help improve efficiency and the quality of care we provide. The vision is to make St. Joseph Hospital's Emergency Care Center the new benchmark for a rapidly evolving healthcare system.
Our vision of a St. Joseph Hospital Emergency Care Center must be realized. Your support will guarantee the people of Orange County and the patients of St. Joseph Hospital the best health care available when they need it, especially in an emergency. Thank you.